I get emotional when I see how good you are. I just love you so much. Ooh, it's got a hair on it? That's my hair.
I'm Scylla, and this is Lorenzo. We are doctors looking for a way to combine our passion for medicine with our love for exploration. We picked up our lives and sold all our stuff to start a new adventure.
Hit the like and subscribe and let's go. Hey guys, it's Lorenzo. I wanted to talk to you a little bit about my handheld ultrasound probe. I've gotten some questions about, what is this thing and how can you just carry it with you? And it's an ultrasound. And well, it's amazing. I have to say that this is possibly one of my favorite tools. And there's actually some emergency physicians that say that you don't even need a stethoscope anymore. All you need is an ultrasound. Typically, when you see an ultrasound in the hospital, it's this big, bulky machine. Say you are pregnant and they have to take a look at the baby. And the ultrasonographer, the tech that uses the ultrasound, brings in this huge machine and there's all these probes on it. And they get these live images, no radiation. It's really, really cost efficient. Every time you're using it, it's just the electricity used to run it. And it's, like I said, very safe. There's no heat, there's no other energy that's coming out of it. Most of those ultrasound machines work is they have little crystals at the tip that goes against your skin. These are piezoelectric crystals. When electricity goes through them, they vibrate. By playing with the electricity that goes through the crystal and the specifications of that crystal, you can have a sound wave that reaches a certain frequency. Ultrasonic frequencies are what we use to image tissues inside the body. Ultrasound travels really well through water. It doesn't travel so well through air. So most of our body is water, our muscle, fat, bone is not water. And so in fact, it goes through everything and then it hits bone and it's like a hard barrier. It can't see beyond that. It can't see inside your lung because it's full of air unless you have a disease process where the lung is filled with fluid like a pneumonia, or in which case it would be pus, or heart failure where your heart can't push through the fluid. So that's how your typical ultrasound machine works. It's got these piezoelectric crystals that vibrate at ultrasonic frequencies, and the computer algorithm that's always proprietary. Every ultrasound creator has their proprietary algorithm and way of fine-tuning it, is able to create images based on the sound traveling back to the sensor. So the ultrasound probes emit the ultrasound and also receive it, kind of like a bat uses sonar to echolocate and figure out how far is that delicious, scrumptious bug. So the difference is, with handheld probes, they've had to try to pack that technology into a portable format. Butterfly was one of the first ones that kind of revolutionized the field by bringing the cost of these machines down. I was working in a hospital in Alaska and I helped them purchase a full ultrasound system for their emergency department. And you want to get the ones at this time that are the full big machines because they're going to have the most high resolution. They're going to have the specific probes that are specially designed to look at the heart, the ones that are specially designed to look in the abdomen, the ones that are specially designed to look at very superficial fine detail. And that one costs upwards of $70,000, $80,000 US. Butterfly came out with a probe a few years ago that cost $2,000. So you can see the vast difference and in cost to play here, and it made it more affordable and easier, especially for global health work. And so this is why I obtained one of these probes for global health work in emergency medicine, because point of care ultrasound in emergency medicine is such a central part of our workflow. We use it to provide an extra data point for a lot of our workups and diagnosis making, and for procedures as well. So enough talk. Let's get into why I love this thing so much. So this is the probe right here. It connects to an tablet or a phone, and all you need to do is just plug it in. Let's plug you in here. Plug it in, plug it in. You download their Butterfly app and it interfaces. So it immediately tells you, would you like to communicate with the probe? And it takes you into their app. A little bit about the probe itself. You can see this is where the sensors are. The reason why these probes are so much cheaper, I think, as far as I can tell, is that they actually don't use piezoelectric crystals. The sensor is actually on a chip, on a semiconductor chip, and they take about 9,000 micromembranes and put them into this rectangular format. And these wobble at those ultrasonic frequencies and essentially produce a similar effect as the piezoelectric crystals at a fraction of the price, because those crystals, as you can imagine, are quite expensive to process, harvest, and set up in that pattern. So the nice thing about this is that the onboard computer does all the processing work, and so it can make the signal high frequency, which is what we use to look at very shallow things, because high frequency, very tight waves of sound disperse their energy faster and don't go as deep. So it's really good to see superficial tissues. It can go low frequency disperse less energy in the tissue, and that's really good to look in the abdomen, look at deeper tissues. And then it has kind of an in-between mode that's really good at capturing fast movement, and that's used for your cardiac view, and it's kind of a cone-shaped field of viewing as well. So I mentioned earlier that ultrasound doesn't pass through air very well. So the one thing that you need, besides your probe, is ultrasound jelly. When you go to the doctor's office to have your pregnancy checked, ladies, you get this ultrasound gel put all over your belly. They're really nice in a lot of places, and they warm it up for you so it doesn't feel as chilly, but all it is just a water-based, water-soluble gel that's, I think it's like food grade. And this is the interface that you need between the sensor and the body. So when you have this there, it allows the ultrasound waves to bypass that thin layer of air that inevitably exists between the sensors and your body. If you don't have this there, you might be, if you press hard enough, you might be able to get some image, but it's just not going to be as crisp as when you have this. Another thing you can do, especially with small parts, like if you want to ultrasound your hand, is actually put your hand in a basin full of water, and then you don't even need the gel because you have the water, and you can just immerse this in there and image without even touching the hand. And that's really nice because this is IPX7, so it's very waterproof and safe to dip in water. And if you have a very painful injury, you don't actually have to touch it because it goes through the water. There's actually ways that you can make your own ultrasound gel. So if you're in a setting that you just can't buy ultrasound gel, or it's not available right away, I've gotten away with just using water, just wetting the probe. But obviously that's really thin. So if you use like some sort of a thickener, like cornstarch kind of thing, you might even be able to just do cornstarch and water and get a pretty good gel. There's actually studies on what is the best homemade gel recipe. There's even sites online that teach you how to make ultrasound models, because we like to use different gel-based models to learn ultrasound, especially for IV and procedure placement. Because imagine if you're taking a needle and you're trying to guide it inside of a blood vessel, you ideally would like to practice on something that's not alive and can't express pain. And so you put this needle in the gel and you can follow it as it goes through the tissue. And you can do this with, I've heard one thing that's really good is those transparent candles that are kind of a soft jelly material. If you melt a lot of that, it's actually a pretty good transducing gel. So there's just one button on here, and this, when you press it, it tells you how much charge there is, and it also takes a picture of what it's imaging at the time, so that it's kind of a or touch-free operation. Say somebody else is holding your phone for you, or you don't want to have to touch your phone, then you just press on this button and it takes a picture for you. And so it records pictures and it records videos, and you hold the probe like a pen. That way, the closer you are holding it to the sensors, the more stable it is when you want to take pictures. Imagine if you're holding it up here, see, like it's just not very stable. And so I tell all my learners, you want to hold it very close. There's even like a little divot where you can put your finger, and that really helps you control. Some of the movements that you do with the ultrasound are one of the first things that I teach. You slide, you rock, you tilt, rotate, and I think I'm missing a few others, but essentially moving in all different axes to get different cross sections of the tissues underneath. So if you look at this blood vessel, this one is round and it's pulsating. And when I press, I'm pressing right now, it's not compressing. That's good because it's my carotid artery. Right next to it, there's a floppy thing. If I bear down, increase the pressure inside my abdomen, look at what happens. So I just held my breath and bared down, and that basically blocked the venous flow from going back to my heart, and so it filled up in my neck. And so right now you're seeing my liver closest to the top of the screen. I'm going to increase the depth a little bit. And there's my kidney right under it. So you see that. I also want to talk a little bit about the downsides of using a handheld probe. I think the biggest downside for me personally is that you need to use one hand to hold the phone and one hand to hold the probe. On your standalone systems, it's usually mounted on like a tower. It's like a laptop based format, and the probe is plugged in. You don't need to be holding anything else. You use your left hand to press the buttons and control the device that way, but you're pretty hands-free. And it's really important when you're doing procedures, because I'm right-handed, and the procedures, you hold the probe with your non-dominant hand and you do the procedure itself with your dominant hand, so that you are free to use everything. So somebody else, if you're plugged into a phone, needs to either be holding the phone for you, or you need to prop it up. And I've ended up propping up like the phone like in between the patient's legs, which obviously is not ideal. Or, you know, even if you're holding the phone, your hand, which is interacting with the patient, is on your personal phone, which goes on my face. So in terms of the infectious disease standpoint, it's not ideal. Some people get around this by only using it with like a tablet, and they will mount the tablet on some sort of a holder that you can wheel around, and that way you have a sort of semi-permanent fixture that you're not as worried about getting dirty, or that you don't need to be constantly holding. But it's not the end-all be-all in terms of your ultrasound quality and system. I use the Butterfly iQ Plus ultrasound probe. It plugs into my phone, and it's really convenient. I control it with the app. It holds a charge all day long, and it's rechargeable with a little wireless charger, and it's very convenient to use, very convenient to travel with. Doesn't weigh a lot. I think it's revolutionizing access to ultrasound, and I'm really happy that the field is pushing in that direction and innovating and making new devices that push the price point and push the quality and resolution of the images. And I'm excited to see what comes next.